Hey everyone, Dr. Brace here for Facial Plastics Friday, and today I want to talk about lower eyelids. There's lots of funny things that can happen to the lower eyelids as we age, and just at any age really. One of them is xanthelasma. Xanthelasma is yellow cholesterol deposition in the lower lids. It can be upper lid or lower lid. And that cholesterol deposit can be in the skin, but I often find that it's not just skin, it's actually into the muscle, the orbicularis oculi muscle. And there's lots of things you can do to get rid of it. Some people would use a laser or liquid nitrogen or dermabrasion or chemical peel to try to remove that lesion. I've tried all of those things in the past, and I find they just leave a red plaque of scar in place of the xanthelasma. So you trade a white plaque for a red plaque. So I don't really like those destructive kind of surface abrasive things. What I really like doing is just cutting it out. And so I use a pinch technique where I gather the skin, pinch the skin around it and cut it out, because that allows me not only to remove skin, but also to get down into the muscle and to remove the strips of muscle that are affected. And that doesn't affect the way you close your eye or any of the function, because it's usually very isolated small spots, but it does completely remove the xanthelasma. So that's number one. Number two, what else can happen to your lower lids? You can get excess skin. You can get wrinkles in the skin, and that can be tightened surgically where you have to cut skin out, or you can use a laser, a CO2 laser, and you can resurface and tighten the skin with the laser, and that really works beautifully. The other thing that can happen to the skin is it can get pigmented. You could get brown discoloration from the sun, from sun exposure, from environmental pollutants, other things, and thinning of the skin, which can then show the maroon color of the muscle underneath it. And CO2 laser does help remove that pigmentation from in the skin itself. Another thing that can happen to the lower eyelid is protrusion of the fat pads. I've talked about this a lot, and we usually do transconjunctival approaches through the inside of the eyelid to trim and or move those pads down into the cheek to smoothen that transition. And we often use fat grafting to also build up the volume in and around the lower lid where you're starting to get hollowing to make that smooth. And the other thing that can happen with lower lids is prominent veins. A lot of people are bothered by big blue kind of serpentine or twisted veins that happen in the lower eyelid. And the issue with these is they can cause raised ridges and they can cause discoloration. So they can look really blue-green and create this strange hue to the color of the skin. And so a couple of weeks ago, almost I guess it was a month ago, I talked on a Wednesday about the case I was doing where I was ligating the veins, removing xanthelasma, and using CO2 laser to tighten the eyelid, as well as to remove some pigmentation. And then we did fat grafting on top of that to help with the volume loss. And so I'm going to show 1 month results for this patient. She's been gracious enough to share them. But if you have a look here, I'm going to show the front-on view or the anterior-posterior AP view. You can see that 1 month later, the amount of pigmentation is greatly improved with CO2 laser. The volume is greatly improved with fat grafting. The vein, the real prominent vein, especially on the right-hand side, kind of on the outside portion, is completely gone. You can actually see a little tiny bit of white sutures poking out through her skin. That's a vicryl dissolving stitch that I used to tie off the vein when I divided it and ligated it. So that's just extruding. I removed that when I saw her in clinic this week. And on the left side, you can also see similar changes with that vein, which was smaller, but it's also there, also completely gone. If you look at the oblique views, again, you get the same view of the improved color. The xanthelasma from the right lower lid is completely gone. The volume is better and the vein is gone. And again, if you look on the other side, on the left-hand side, same story. And so this is an example of approaching the lower lid with multiple different techniques for multiple different problems. There's no one solution. Often with the lower lid, it's often a matter of addressing the fat, addressing the skin, sometimes addressing the veins, sometimes addressing the volume around the eyes. And so combined technique lower blepharoplasty is probably the most common thing I do in my practice for lower lids, because it does need a combination of techniques to address the combination of issues with the lower lid. Hope that's helpful and you learned something from that. Everybody have a great July weekend. I'm having a long weekend this weekend, and we'll see you next week for Facial Plastics Friday.